Excellent. Good morning, everyone. Thank you so much for being here this morning. Today I'm joined by County Supervisor and Chair of the Board of Supervisors, Nathan Fletcher, to talk about our regional response to homelessness and the specific issue of homelessness in downtown San Diego. I want to acknowledge that we have a number of other key leaders in our community that are with us this morning, including Council President Pro Tem Stephen Whitburn, who represents Council District 3, that includes downtown San Diego, Tamara Kohler, the CEO of the San Diego Regional Task Force on the Homeless, Rick Gentry, the President and CEO of the San Diego Housing Commission, Dr. Luke Bergman, Director of Public Health Services for the County of San Diego's Health and Human Services Agency, Barbara, you can applaud, that's fine. Yeah, all right, now Barbara, if you don't get that kind of applause, don't worry. Barbara Jimenez, who is the Community Operations Officer for the County Office of Homeless Solutions and Equitable Communities. Yeah, thank you, Carlos. Thank you. I believe he may arrive. I want to acknowledge Deacon Jim Vargas, the President and CEO of Father Joe's Villages, Betsy Brennan, President and CEO of the Downtown San Diego Partnership. We also have representatives, as you can see, smartly dressed behind me, from the PATH, or People Assisting the Homeless, as well as the Alpha Project. So let me dive right in. I'm going to just apologize in advance. This is some dense stuff. There's a lot I'm going to try and share with you this morning, and that's because this issue is significant and it deserves this level of attention and detail. But let me start right at the offset by saying very clearly what is happening in downtown is wholly unacceptable for the residents and for the businesses of this community, but most especially for the people who are living unsheltered in encampments along our sidewalks. The current situation creates a real public health and public safety concern. And if we do not persistently clean our sidewalks where people are living without adequate sanitation and personal hygiene, we know that the consequences will be deadly. We experienced this directly back in 2017 when a hepatitis A outbreak killed 20 fellow San Diegans who were living then on our streets. We cannot allow this to happen again, ever. And that's why the city's Environmental Services Department routinely visits areas of high concentration of homelessness to make sure that our streets and sidewalks are clean. In March, I implemented a series of policy changes to make these essential sanitation activities more compassionate, more predictable, and more responsive to the needs of our unsheltered residents. Soon thereafter, I also announced the launch of a new coordinated street outreach program operated by People Assisting the Homeless, or PATH. This program employs a person-centered, housing-focused, neighborhood-based approach to cultivating trusting relationships with unsheltered residents. This approach is a proven long-term outreach strategy that actually helps people get connected to housing and services to end their homelessness. Today, I'm announcing that we will be deploying this strategy in a concentrated campaign in downtown San Diego. This effort, which will be coordinated by the San Diego Housing Commission and the San Diego Regional Task Force on the Homeless, will begin on June 28th. It will last for 3 to 4 weeks, weekday from 8 a.m. to 10 p.m. We will mobilize outreach teams from PATH, the Downtown San Diego Partnership, Father Joe's Villages, as well as the Alpha Project. Their efforts will be complemented by the county's public health nurses and behavioral and mental health resources through operators contracted by the County of San Diego. The San Diego Police Department's homeless outreach team will participate in a supporting role, including providing transportation and logistics assistance. We are bolstering this campaign with a phased expansion of capacity at 4 shelters, which has been made possible by the easing of the statewide COVID-19 restrictions. In the coming weeks, roughly 300 beds will be added to bring our total capacity at our shelters to approximately 1,400 beds. During this phased expansion, the city and its shelter operators will provide ongoing access to vaccinations and regularly monitor COVID test results to ensure that everyone remains safe. And we'll be using the expanded capacity of the newly opened Homeless Resource Center to connect people with permanent housing and programs. This campaign reflects the need to do everything that we can to protect public health and to support our unsheltered residents. Now, the second thing I'd like to highlight this morning is the unprecedented level of collaboration between the City of San Diego and the County of San Diego on our homelessness crisis. I'm grateful that we finally have a leader at the county in Chairman Fletcher who understands that the homelessness is not only a responsibility of the City of San Diego, but the County of San Diego and the broader region as a whole. The county, which administers public health and behavioral health programs in our region, has to play a significant role in our response. Nathan Fletcher and I talk regularly. His team and my team talk regularly. And I can say very simply that he gets it, and we are lucky to have his leadership. As a result of our partnership, our budgets on homelessness are carefully and purposely aligning to make maximum impact for those who need help. This past Monday, the City Council voted unanimously to approve my proposed budget, which includes $10 million to combat homelessness. I want to thank Council President Pro Tem Stephen Whitburn for his leadership on this issue, as well as all members of the City Council for their support of this funding. It will create a robust Department of Homelessness strategies and solutions in the city, increases shelter capacity for those struggling with addiction, and expands rapid rehousing programs as well as street outreach programs. It also includes funding to train additional case managers to work with our unsheltered neighbors. We have a shortage of case managers and outreach workers, which is why it is so important to make this needed investment in training to increase the number of people who can help us do the critical work of interacting with folks to help them get off the streets. I want to pause here and express my deep appreciation to the current case managers and outreach workers who do this very important work. Many talk about wanting to help the homeless. These are the individuals that do the work of helping the homeless. They do it under extremely difficult circumstances, and they have the city and the county's undying appreciation. They're truly heroes in this crisis. This year, the city and the county's budgets are just the beginning of the investments we plan to make to end chronic homelessness. Governor Newsom has proposed budgeting $12 billion over 4 years to increase our efforts with regard in homelessness response. $7 billion of those dollars would fund housing solutions, including purchasing more hotels like the 2 residence inns that we converted into permanent supportive housing last year that are currently housing more than 400 San Diegans. Chairman Fletcher and I will be advocating for San Diego to get every single penny that we can to add to the capacity of our region's homeless ecosystem. Finally, I want to point out that these developments are aligned with the City of San Diego's Community Action Plan on Homelessness, our blueprint for addressing our homelessness crisis. All of our efforts are coordinated regionally, focused on housing, person-centered, and following national best practices. With that, I'm happy to turn it over to my partner in this particular effort, and many efforts, but particularly this effort, Chairman of the County Board of Supervisors, Supervisor Nathan Fletcher. Nathan?
Thank you, Mayor. The city-county relationship has never been stronger. There is a long history that many of you all have lived through, and that is in the past. Today we have a city and county government aligned. We are moving together. We are talking. I think the mayor and I probably talk every single day about. Our teams are talking. We're working. We recognize the critical and urgent need to do more around homelessness, but we also recognize the critical and urgent need to do things differently. It's not just a matter of doing the same thing that we've done. We have to explore new ideas, new opportunities, new ways. We know the impact, both for those who are experiencing being unsheltered and the broader impact around downtown and countywide. And at the county, we are taking efforts around homelessness that address the entire county, but we focus in those areas where we know the problem is most prevalent and highest, in particular areas like the downtown. And I appreciate tremendously the mayor's leadership. I appreciate this mayor. I appreciate his willingness to be collaborative, to get us all together, to sit down and talk about all of the things that we can do. And both the city and the county are dedicating substantial portions of what they received in their ARPA funding towards homelessness and behavioral health solutions. With that funding, we're able to invest in better ways to reduce the number of encampments and in helping fill a void in our current service delivery model. And I want to talk for a minute about an effort that the county is working on in close coordination with the city to augment everything else they're doing to meet what we see as a gap. an area where we need to step up and do it a little bit different. And while each person experiencing homelessness has their own unique set of circumstances, both addiction and mental health injury are common contributors to chronic homelessness. Our new community harm reduction teams, which we affectionately refer to as CHART, and low barrier bridge housing programs, both of these set to launch in August, will provide a better way to support this population and a array of services that is presently not funded at the level it needs to be and doesn't exist where we need it to exist in order to have a significant impact. A chronic homeless person with co-occurring disorders, suffering from both mental health issues and substance use issues, needs very specific services, very specific approach, very specific sheltering programs. And a lot of the normal things that the city and the county have done in the past simply don't focus in on approaching these folks in the right way, with the right care, at the right time, and giving them the right options. Instead of just throwing money at a problem using the same model and expecting a different result, together, we're beginning to switch the game plan a little bit, to try something a little bit different. So many shelters and housing opportunities for homeless individuals now require you to be sober or actively committing to sobriety. And we need to provide opportunities to get folks into housing, to get them into a place where they can get that without condition. Many of our service providers who do incredible work, and I want to echo everything the mayor said earlier about the tremendous work that our folks are doing on a daily basis. But these folks need help. They need more resources, they need more assistance. And so what we want to step in and do with our CHART program and with dedicated housing for these is have unique and dedicated resources for some of those cases that are the very most difficult, that are the hardest individuals out there. When a person is suffering with addiction and mental health issues, it's not just a matter of getting them a meal, a cot, a roof over their head. That may not be enough to get them to come inside. And if we're being honest, there are some amongst this population who don't trust that they will actually get the unconditional, non-judgmental help that they really need. Many of these individuals who remain on the streets night after night, resistance to choosing a life of sobriety and supportive surroundings, are often cycling in and out of our jails, creating more barriers to recovery, an inability to build that trust, an inability to feel seen as a human. But that doesn't mean we give up on them. It means we need to work smarter. We need to find new, better ways to meet them where they are. And we think our community harm reduction teams, paired with housing opportunities for these individuals, will help augment and complement so many of the other efforts that are moving forward. Community harm reduction teams are trained to engage this very specific population. These outreach teams include substance use counselors, peer support, mental health clinicians, and psychiatric consultation with nurse practitioners. They are trained to engage specifically with some of the most chronic and most severe individuals, to build trust, to meet them where they are, provide them with resources like naloxone, provide them with harm reduction resources like syringe services, keep them safe, talk with them about the harms of using substance, but offering them a path to go forward in a supportive and collaborative way. These teams will also provide referrals to both primary care and behavioral health services, medication management, and medication addiction treatment. The community harm reduction teams will also connect them to low barrier and immediate access bridge housing, including short-term and safe haven housing consistent with best harm reduction practices, where clients can then be connected to permanent supportive housing, which we know is greatly needed throughout the region. Over time, with persistent engagement, persistent supportive engagement, we expect to achieve better outcomes with this strategy because it is a best practice designed to reach this very hard to reach subset of our homeless population, people that are experiencing chronic homelessness. The goal is to get them off the streets, engaged in services, and we know get them on a path to true treatment for many of the issues and challenges they face. To make this new initiative a success, it takes both of us, the city and the county, along with all of our partners, and many of them are here today. The County of San Diego In our recent allocation of our ARPA funds, dedicated $85 million to help address issues facing the homelessness. But it is not just a question of money. It's not just about more money. It is about spending that money in a new way, bringing in new intensive programs and services, trying to reach, again, those hardest to reach individuals with a different approach. And so we will be funding the CHEART teams along with the behavioral health and supportive services. We will also be working to expand safe haven sites and bridge shelter sites and working again with our city partners and with all of our providers to not just have the engagement teams, but have an individual and a place for these to go. And I appreciate the city's commitment. I want to thank the mayor for what they are stepping up to fund, for everything that they have going and the commitment that they bring. And in closing, just let me say again, addiction and mental health injury are common contributors to chronic homelessness. If you have been homeless for any significant amount of time, you no doubt experience trauma that compounds those challenges and it compounds those problems. And it's easy to understand how someone gets to a place where there's not trust, right? There's not an ability to say, well, if I just go into that thing, it's all going to be okay. And so for some of these individuals, it takes a different approach. It takes dedicated resources. It takes a special focus to engage, to build trust, and to have a location that they would be interested and willing to go into. And so one of the things we're doing, in addition to everything the mayor outlined as a county, is focusing again on these CHEART teams and dedicated spots for these individuals to go. And so we're thrilled as a county to join the mayor in these efforts, to join the Regional Task Force on Homeless, the Downtown Partnership, all of the service providers that you see here. We recognize we have to do more. We recognize the severity of the situation we face, and we recognize that the need for action is here, and we recognize that we will also be held accountable for the impact of our efforts. We also recognize that this problem did not create itself overnight. This is a problem that's been generations in the making, and so we move with a great speed and with a great focus on trying to do it. But we also recognize launching new programs with new staffing and new people, and all of these never go quite as quick as we want, but we are moving as quickly as we possibly can to be of assistance. So thank you, Mayor, for all of your efforts, and to your team and everyone who's here. And the county is thrilled to be a partner with the city. Thank you.
Thank you, Chairman. Thank you, Council President Pro Tem. Thank you to our providers that are here. Thank you all for helping us get this word out. So the information we're sharing today, I want to start by actually just expressing my appreciation to San Diegans who chose to get vaccinated, which has allowed us to help end the public health order, allow us to reopen our economy, increase the number of beds that are available to those who are unsheltered, bring folks back to work, including those who work with our homeless in our homeless providers, allow the transition now to this concentration of services starting June 28th, where we'll be focusing in the downtown area where the problem is most acute. The concentration of resources in this particular community over a period of about a month's time to hopefully get some of the situations that are, again, wholly unacceptable off of our sidewalks into housing, into services, and keeping folks housed in the long run. You heard the long and medium term commitments of both the city and the county to make sure that we continue to be persistent in this matter. The conclusion of the pandemic does allow us to put more time and attention at this incredibly important issue, and I appreciate San Diegans from every corner of the city. This is not just a downtown issue. Every corner of the city demanding a change in the way that homelessness is handled in this city and in this county. Chairman Fletcher, Council President Pro Tem Whitburn, and myself are all here saying that we're delivering that change, and we appreciate the chance to share all that with you this morning. I believe we'll be hanging around for answer questions one-on-one. I also encourage you to talk to some of our providers and partners who are here. As I mentioned, the Housing Commission and the Task Force, who are helping us lead on that concentration of services in downtown. The Downtown Partnership, who've done this coordinated street outreach for a long time. PATH, who's been doing it through the city-funded effort the last number of months. You can get a sense of what this looks like, how it'll be executed, and how we can hopefully change the status quo on this important issue and drive the change that everyone wants to see on our streets. Again, thank you for being here, and I'm happy to take questions. I'll step off over to the side. Thank you, guys.